Hello YouTube. Today I'm going to go over something that's extremely important in regards to health. I think I had touched on it in one of my other videos, but I'm going to expound on it a little bit right now. And that is blood pressure. We talked about the potassium-sodium ratio as far as keeping a healthy blood pressure. Doctors would prefer to give you medication to keep your blood pressure down, but and of course, there's a lot of different factors that affect blood pressure. Weight, physical conditioning, hereditary, those are all factors. But if one watches their diet and tries to stay true to that potassium-sodium ratio, which as I had mentioned earlier is 4:1, 4 parts potassium, 1 part sodium. So if you're consuming 1,000 milligrams of sodium per day, you should have at least 4,000 milligrams of potassium. I explained in my other video how to possibly do that. You're not going to get it from processed foods. Most likely you'll get it from, you will get it from green leafy vegetables. Different types of fruits are high in potassium. The fruits you have to be wary of because they do contain a lot of sugar as well. So fruits in moderation, but green leafy vegetables, preferably in a juice type configuration. If you juice it, instead of sitting there and eating a whole giant bowl of green leafy vegetables, then you can drink that instead, and maybe within 1 or 2 drinks throughout the day, you should have your required amount of potassium. Now, today I'm going to go over doing blood pressure. Now, I just came from downstairs. I just came from upstairs rather, and my blood pressure. I usually have to wait about 10 minutes and have it settle before you actually take your blood pressure. You should be in an upright position. I'm going to be using an automatic machine, nothing fancy. It's a RelyOn brand. I'll show you it in a minute, and you get it from Walmart. So, and it's good to keep an eye on your blood pressure, because one thing about blood pressure, they call it the silent killer. And it's a silent killer for a reason, because it doesn't really exhibit symptoms until it's really out of whack. And by then, you could have a cardiovascular event and it may be too late. So it may not be a bad idea from time to time to check your blood pressure, even if you're healthy. You could pick up arrhythmias, skipped heartbeats. You can also look at the systolic and the diastolic and tell whether the working part of the heart, which is the systolic, is working too hard, and the diastolic is the resting portion. And if that's working too hard as well, which could lead to cardiovascular issues at some point on the line. So what I'm going to do is just simply do my blood pressure on this machine right here. I'm going to show you how it pretty much works, how to set up the cuff on your arm, what position you should be in order to get the best results. Now, as I said, I just came down a little while ago, so my blood pressure readings might be a little bit higher than what I'd like them to be because I didn't take the full 10-15 minutes to rest. But I wanted to show you that as well. So without further ado, let me go ahead and focus the camera down towards what I'm doing here. This right here is the RelyOn. As I said, I'm not selling this brand. You can get this from Walmart. 20, 30 bucks, something like that. I don't remember how much I paid for it. Make sure that you have the proper size cuff as well. I have a large arm, so I have the large cuff, okay? And the way that you put it on, if you see this stem right here, you have an artery going down the middle of your arm called a brachial artery, okay? And it's right around here. That's the one they usually take the blood from when you do blood donations. So you want to look for that artery, and even if you can't see it, it's right here in the center generally. So when you put this on, you're going to put it on with this tube facing the same way as the artery. Make sure that it's snug but not too tight. And of course you can adjust it with this strap right here. Snug but not too tight. You should have your arm around heart level, if not maybe a little bit below, but at heart level gives you the better reading. And then palm up, relaxed. Try not to talk or move around, while you're doing this, and just press the start button. And as I said, I expect it to be a little bit higher than normal, only because, as I said, I haven't taken the time to rest, and this is a resting blood pressure. So let's see what we get here. I'm gonna turn this around so you guys can see it, hopefully. So it says 141 over 101 now. Now, as I said, that is high. So in this instance, I would take a little bit more time to rest and then go ahead and take it again. Now, I do not take blood pressure medication, and my blood pressure varies from day to day. Sometimes it could be 120 over 70, sometimes it could be 120 over 80, and sometimes I get a weird reading like this one right here, which most likely isn't indicative of what my blood pressure is, so they're not 100% accurate. In about a second or two, I'm going to take it one more time just to see that if it stays consistent. I'm going to raise my arm up a little bit more and press start here. Bring it up to heart level. Okay, now you can see a little variation here. It's 146 over 97. That is sort of in the high level. Now, what I can attribute that to is maybe what I ate yesterday. I have been fasting for about maybe around 12 hours now. It hasn't been that much. But I did have foods yesterday that were a little bit higher in sodium and not as much in potassium. So that could be the reason for this. Now, I guarantee that if I take it a little bit later on today, it'll be back down to normal levels. But keep in mind, too, that the blood pressure fluctuates. When you're up and around, you can have readings like this when you're up and around and moving, and that's normal. The blood pressure that the doctors look at is what's called a resting blood pressure. That means when you've rested about 10, 15 minutes, you're in a relaxed position, and the blood pressure goes down to normal levels. This could probably contribute to maybe having too much sodium, not enough potassium, as well as the fact that I just sat down. So, but I just want to give you an overture on that. Now, why is it important that you check your blood pressure every day? Well, it's important because as I said, it's referred to as a silent killer, and you don't know what the status is unless you actually check it on a regular basis. Some people have hereditary issues, which will normally make their blood pressure a little bit higher, but most of it is due to the American diet. So what I would suggest is do a little bit of research on the foods that you're eating. Make sure that the foods that you consume have a high enough potassium content and a lower sodium content. Now, you could have higher sodium as long as you increase your potassium. Now, I'm not a medical doctor. I have been in the medical field for about 20 years. I'm not giving you any type of advice that, in lieu of a doctor. These are the things that work for me, things that I've noticed throughout my lifetime as far as keeping my health in check. So I will put up another video at some point on the line for other different types of medical issues. And thank you for watching. Okay, this is an update to the blood pressure video that I just made. I wanted to show you after 15 minutes of resting what my blood pressure values were. So it's 126 over 85. It indicates 80 pulse. Now it does say high on the top, and that the reason why it says high is because the Medical Association depicts blood pressure anything over 120 over 80 they consider high. Now, back when I was in the military and I was a corpsman, the values are 100. The top values are 100 plus your age. So if you were 60 years old, it would be 160 would be the top value. Now they've substantially changed it since then. I can't say that where they put it at is the better, or if it's accurate or not. I know that the drug companies have a tendency to make things look a little bit worse than what they were because they need to sell their medication. Having said that, there's a lot of great doctors out there who do great work, and I consider a doctor a healer. But there are some people out there that just want to give medicine and dealing with either type 2 diabetes or blood pressure, they want to give medicine in order to, just keep their patient sort of in a, the status quo, if you might say, so they can keep that patient. I'm not saying all doctors are that way, and I'm not even saying most doctors are that way, but there are some out there. Hey, why should we find a cure for this? Why should we give them a remedy, a permanent remedy for type 2 diabetes and or blood pressure issues when we can keep them on these medications? And it is of my opinion that every single medication out there, regardless of its intent, is toxic to the body. It's one of the reasons why I try to do as many, homeopathic remedies as possible. But having said that, as I said, you're looking at the blood pressure from where it was when I took it earlier, and of course, what it is now, you can see the difference after resting for about 10, 15 minutes. Okay, so when you're going to do your blood pressure, make sure that you sit down for a bit, rest and relax. Don't talk and move around too much. Just relax. Take some deep breaths, and then after 10, 15 minutes, make sure that your arm is at heart level, if not a little bit below. A little bit above wouldn't hurt either. Take your blood pressure in a quiet, relaxed environment, and that'll be more true to what it actually is on a regular basis. Okay, thanks a lot.